Autism is a neurodevelopmental disorder with a strong genetic component. It starts very early in life. The symptoms manifest themselves really from the beginning of development. And we define autism behaviorally because we don't have any biological markers yet, although we will probably have some in the next decade. Right now we define it based on behavioral symptoms. So we look for very specific things depending upon the age of the child. For young children, we look for things like whether or not they respond to their name. In fact, responding to your name is one of the earliest signs or symptoms of autism. Young kids with autism have a lot of trouble responding to their name. It's almost as if they don't even hear their name. They may not orient at all to the person who's speaking. Another one of the early signs is whether or not they're babbling appropriately. So in younger kids, kids between the age of 1 and 1.5, you really should be getting some productive babbling type speech that sounds like regular speech, although we might not be able to make it out as words. In kids with autism, if they do babble, we typically will not recognize the babble as being the same as the kind of babble. It will be more disjointed than what we expect to hear, or we might not hear any babbling at all. There are some high-functioning individuals who actually speak precociously. So very early in their life, they begin to use language. So that's not a perfect sign because it misses some of those high-functioning kids. Another example sign is how a child responds to when you point. So if you point out something, anybody, including young children, will look to where you're pointing. They want to know what you're pointing out. Young kids with autism oftentimes will not respond to that. That's called responding to joint attention, or the ability to attend on something with somebody else. So that is also a big sign of autism spectrum disorder early in kids. As kids get older, we begin to look at more obvious social symptoms. Are they making appropriate eye contact? Is their ability to go back and forth in a conversation or interaction? If the child can't do those things, then that's going to be a sign or a symptom. There's also this whole other set of signs and symptoms we call restricted or repetitive behavior. And those can manifest very obviously, like repetitive motor behaviors, flapping your hands, spinning in circles, jumping up and down in place repetitively over and over and over again in a very stereotyped way. Not just like you're excited, but really in a stereotyped fashion. As kids get older, if they're higher functioning, you may not see those kinds of behaviors, but instead you'll see things like whether or not they restrict their interests. So they're only interested in trains, and all they ever want to talk about is trains, or SpongeBob, or Pokemon. So they have this very particular interest that is very restricted and narrow, and you can't really have conversations about much else, or else the conversation ends quickly.